Hi everyone, welcome back to Melanoma 101 presented by AIM and Melanoma. I'm Melissa Wilson, and in Melanoma 101, my goal is to break down the topics of melanoma from prevention and early detection all the way through diagnosis and treatment of melanoma in tinier bite-sized pieces to make it a little bit easier to understand. Today we're going to be talking about your self-examination. Now, the self-exam is something that's extremely important as part of prevention and early detection. It goes along with a regular scheduled dermatologic or medical provider visit of to look at your skin. But the self-examination is extremely important. And I will tell you that in about 50% of cases, melanomas are diagnosed by the patient. Because let's face it, you live in your skin, so you look at it every day. So we're actually the best people to monitor for changes, which is one of the most important signs for detection of not only melanoma, but other skin cancers as well. So what we need to know about self-exam. What kind of tools do we need? So you need yourself, because that's extremely important to look at your skin. You also can sometimes ask for help, either by your significant other, a friend, somebody that you feel comfortable looking at your skin, to look at places that are a little bit harder to see on your own, like your scalp, the back of your neck, your back, your behind. So there are places that are a little bit more difficult sometimes for us to see on our own. So enlisting the help of somebody that you trust, even if they don't really know what they're looking for, to really look for things that they think are the ugly duckling or that doesn't look exactly normal to them. Because let's face it, we'd rather have you come in 100 times to talk about something that you think is worrisome and have it be benign than to ignore something that can be potentially more serious. So again, part of the tools, you need yourself and a helper in some cases to make things easier. You need a mirror, because unless you have a fantastic skill of swiveling your head around, looking at the backside of you and the bottoms of your feet and the backs of your legs can be really difficult without a mirror. The mirror will also help you examine yourself on the front side. So looking in a mirror is how we evaluate ourselves every day to make sure we look presentable. So we're going to use the mirror exactly in that same way to do a self-exam. Some other things that can be really helpful is having good lighting. Looking at your skin, much like doing any other task in the dark, is extremely difficult. So making sure that you pick a place that has good lighting so you really can see your skin. A lot of bathrooms have great overhead lighting, especially near the vanity, to at least examine the top half of your body. Some of us don't have a full length mirror, so using a handheld mirror can be extremely helpful for you as well to look at the bottom half of your body. But definitely pick a place that has good lighting so you can really see your skin. Another tip that can be helpful is utilizing a chair, especially with folks that may have a little bit of difficulty with mobility, standing on one foot. You're going to be looking at places like the bottom of your foot, the back of your leg. So sometimes doing a physical exam on yourself or a self-exam without a chair can be extremely difficult. I like to prop my leg up on a chair to look at the underside of my leg and really the bottom of my calf as well. I did do a video from the clinic to the living room about self-examinations, kind of showing you how I go through a self-exam on myself. But you really want to stick to a systematic approach. So for me, it works best for me to start at the top of my head and work my way down to the bottom of my feet. Certainly whatever it is that your method is perfectly amazing, but you want to try to keep the same sort of setup and the same sort of routine when you're looking at your skin so you don't miss anything. So for me, top of the head to the bottom of the feet works best. That's actually how I do my exams in the clinic as well, so we don't forget where we are and leave off and forget an area that could be important. One of the other things that I like to make sure that I keep on hand when I'm doing my self-examinations is really a camera. So I know I had talked about this in prior segments, but when we talk about doing self-examinations, the things that we're looking for are really evolution. So of course, we're going to follow the ABCDE rule. So asymmetry, looking at the borders to make sure that they are regular. Looking at the color of moles, whether they're getting darker, whether they're getting lighter, whether they're extremely dark, whether they have a halo around them, so color is important. looking at the diameter. So moles that are larger have a higher incidence of having atypia in them. So things that are bigger than a pencil eraser can be something that we want to watch for. So ABCD, but really one of the most important parts of a skin self-examination is looking for the E, which is evolution. So moles that are changing. What does that mean? So moles that are darkening in color, that are lightening in color, that are different in color than they were before. Moles that are itchy, are red, or crusting, or bleeding. Moles that are bigger in diameter than they were before. Moles that are darker than the other moles that you have. That's something called the ugly duckling. So when you look at your skin in pieces, and you'll see this on the video that I did on self-exam, when you look at the pieces of your skin, like say we look at your arm in its entirety, and then we look at your trunk in its entirety, we look at your face in its entirety. What we're looking for is the mole that sticks out. So that's called the ugly duckling. And it's been proven over the years that this ugly duckling mole in appearance also tends to be the mole that is the most cytologically atypical. So really looking for those things that stick out, or the evolution of moles, are the characteristics that you want to really keep track of on your self-exam. And back to the whole point of this, taking photos. So when you find these ugly duckling moles, or even if you don't, taking photos of your skin can be a really helpful tool. Now, this can be provided through something called mole mapping or total body photography that can be ordered through your dermatologist or your medical care provider. But also you can take amateur photos at home. So there have been many instances where folks have come into our clinic, have shown us a photo of something 6 months ago, and then we can see it clinically now and see the evolution or change. So taking photos of moles not only helps you determine whether things are different, but it also helps your medical provider as well. So don't be afraid to take pictures of moles that you find on your skin that you might think are a little bit funny. I hope that with these tools and with the other tools that are available on AIM at Melanoma's website, we can really walk you through a self-examination so you feel comfortable performing it. You want to try to do this about once a month. I would pick a day that you won't forget to do it, like maybe the first of the month or the last day of the month. But no matter what, just make sure that you are looking at your skin, because you're your best judge. You know exactly what your skin looks like on a daily basis, and studies have proven that melanoma is most diagnosed by patient or family member. So get out there and check your skin. If you have any questions or need help, you can always reach out to the Ask an Expert line. I am Melissa Wilson. This is Melanoma 101. I hope you have a wonderful day.